I will be talking about the human metapneumovirus. I have to keep checking it. This name is a tongue twister for me. The human metapneumovirus outbreak that is occurring at the moment in China. There have been about 9 countries or so in the African region which have issued a statement in concern to the HMPV to say, you know what, yes, we are following the developments of this virus in China, but you do not need to panic, do not be anxious, right? These countries are including Botswana, Namibia, South Africa, Nigeria, Morocco, I think Egypt is in there, Uganda is in there, Zimbabwe is in there. They've all kind of issued some statements to the public to say, yes, please note that we are very much aware of what is going on and we are doing as much as we can to prepare, to be ready for this potential risk, or to be ready to reduce the risk, to be ready to avert a potential crisis or a potential public health crisis, right? So, but despite that, I think that, people can be too harsh sometimes when media alerts. I've seen lots of comments where people are like, oh, but the media, you are sensationalizing this. There's always a critical message in the coverage. There is an underlying theme across the multiple articles that I've read, which is that there are certain people that will be at risk of HMPV. There are certain nations that are going to be at risk for HMPV. And that's because they may have immunocompromised systems, right? Your body is immunocompromised, there's a higher risk. Countries where there's lack of medical resources, lack of access to medical care, health inequalities. Perhaps we're talking about countries that are already experiencing other public health crises, such as Ebola, cholera, tuberculosis, HIV, and then here comes HMPV, right? In that scenario, those countries have a potential risk. Typically, public health outbreaks magnify and highlight health inequalities. That this news story about the HMPV outbreak really just highlights the issue of health inequalities. This is a story that is magnifying why certain communities are disproportionately affected by health conditions, why certain communities are able to easily avert a public health crisis, right? So this is what is very interesting about all of this news coverage, showing just the factors that lead some communities to have a death, fatalities from one virus, when in certain communities nobody dies, right? Because there are measures in place, health systems are stronger to respond in certain communities versus others. And thank you so much for popping by. I hope you're having a lovely day where you are, but most importantly, I hope you're having a healthy day wherever you're watching me from. Bye.